Hi guys, I'm Dr. Ron Miller with Pursuit Physical Therapy, and today we're going to go over the 5 root causes of sciatica. So sciatica is just a general term for symptoms that are shooting down the leg. It gets misdiagnosed all the time, okay? But there's the most important thing to solve your sciatica is to make sure that you solve the root cause and not just cover up effects. So sciatica in turn is just a general diagnosis term of what your symptoms are. I have leg pain that's shooting down the back or the side of the leg. So let's go over the 5 root causes. One is the most common one. It is normally from a herniated disc. Most of the time, sitting, driving, bending down and picking something up causes your sciatica or your shooting leg pain. You may or may not have back pain with this. Doesn't necessarily have to have back pain, but if the herniation is big enough, and it's pinching on a nerve root, you may get some numbness and tingling also with this in the foot or down the lateral shin. That's the most common cause of sciatica. This is from a herniated disc or a bulging disc or discogenic symptoms. The second cause is more of a stenosis, compression, arthritis in the low back area, okay? With this type of sciatica, people will say that laying down flat, standing and walking, women who are wearing heels, increases that compression load on the lumbar spine, and it pinches and it causes the radicular symptoms of shooting leg pain going down the back. And again, that one also, if it's narrow enough or it's too much compression, you may get some numbness and tingling with that one. Those 2 are the most common ones in general, and again, the problem is in your low back. It's not down the back of your leg. Okay, that's the key thing, because you got to treat your back to fix those. But a third cause is an SI joint problem. You can have an SI joint problem that refers down the side of the leg. Now, this isn't true sciatica. People will say, yeah, I feel it's going down the side of my leg, but it stops at the knee. That's kind of a textbook case there. Normally there's some sort of hip problem also that's adding into this, but true SI joint pathology doesn't refer below the knee. But some people will call this sciatica because they just feel this leg pain that's shooting down the back of their leg. Most of the times with SI joint problems, it doesn't go below the knee, and that's kind of the differential diagnosis there. The fourth one is going to be a piriformis syndrome. Again, textbook with this, when I treat the piriformis, it makes the pain go away. Normally, you'll have a lack of hip rotation, and you'll be very tender right in the glute area and stuff like that. So when I palpate the piriformis, it should be hypertonic or in spasm, and it may cause the actual symptoms again, because the piriformis actually goes right over top of the sciatic nerve. A lot of people have a abnormality too, where the sciatic nerve goes through the piriformis, but that's really rare. Most of the times the piriformis is really tight and in spasm. It's compressing the sciatic nerve, causing sciatica type symptoms. Again, sciatica is just a general name for the symptom. This is true sciatica, but it's not a back problem. So if you go with a cookie cutter approach and they start treating your back, you may not get the results you want. So the key with that is identify, is it the piriformis that's causing your sciatica or not? The last one, which is the least common, is a trigger point in the glute area or possibly even some of the back muscles. So a trigger point is just a tender nodule of the muscle. There's different theories for this, but pretty much to keep it simple, it's just a tender knot within a muscle, and that trigger point becomes painful to touch. If it keeps on getting overloaded, that trigger point can become painful and refer pain other ways. It's most commonly seen with like headaches. You can have a trigger point in your upper trap, causes pain to shoot up the side of your head. That's a textbook case of a trigger point referral. You can still have trigger points in some of your glute muscles, maybe some of your back muscles that could be referring some of that leg pain down. So those are the 5 root causes of sciatica, and if you want to get pain-free and get a long-term outcome, that's the first step that you have to do to solve the problem. What is the root cause of my sciatica? Is it a herniated disc? Is it more stenosis, arthritis, compression in the lumbar spine? Is it an SI joint problem, which is not real sciatica? Is it piriformis syndrome, or is it referral from a trigger point? Once you solve that, then you can customize your treatment based off of that finding, and then you'll get the results you want. So if you have any other questions or concerns, you can visit us online at pursuittherapy.com, or click on some of the links below to go to some of our sciatica pages. I hope you learned something from this, and thanks for watching, and hopefully I see you soon. Thanks.